हाय लिसनर्स, आपका स्वागत है एक बार फिर रेडियो द्वारका में। आज मेरे साथ हमारे स्टूडियो में हैं डॉक्टर गीता बरुआ नाथ। डॉक्टर गीता चीफ ऑफ ऑब्स्टेटिक एंड गायनोकोलॉजी हैं आर्टेमिस हॉस्पिटल गुरुग्राम की, और अभी आके इंटरव्यू में उनसे बात करूंगा। उसके अलावा ये प्रेसिडेंट हैं असम वुमेन्स राइटर फोरम की गुड़गांव ब्रांच की। गीता जी ने असम मेडिकल कॉलेज से अपनी एमबीबीएस की पढ़ाई की और उसके बाद ये दिल्ली आ गई, और दिल्ली आने के बाद 1992 में गुड़गांव चली गई। सही कह रहा हूँ गीता जी?
जी जी, बिल्कुल सही कर रहे हैं।
गीता जी, थोड़ा सा स्टार्ट करने से पहले एक चीज पूछना चाह रहा हूँ। आपका मैंने देखा आप प्रेसिडेंट हैं राइटर्स फोरम की जी, ये इसके बारे में थोड़ा सा बताएंगे, मतलब इंटरेस्ट कैसे?
यस, नॉर्मली मेडिकल साइंस और राइटिंग दोनों अलग अलग प्रोफेशन है, एंड मेडिकल डॉक्टर्स नॉर्मली राइटर्स कम ही होते हैं। बट मैं बचपन से आई लाइक टू राइट, कुछ भी एकदम से लिखना पसंद करती थी, एंड आई वाज इंस्पायर्ड बाय माय मदर इन फैक्ट। एंड there is an organization, All Assam Women Writers Association, which is established in 1974 in Assam, and there are branches all over India and outside India also. Okay. And this is the only women writers organization where there are more than 55,000 members already. Oh. And you won't believe, the writers are so dedicated, and some of them in Assam I have seen so intelligent and dedicated, but they suppose they don't have money to publish, and they will even sell their jewelry to publish a book.
Oh, that's great.
That much dedication they have. So idea is that basically to
so that's why you associated with
that. To spread the literature, Assamese literature to outside world, and outside India literature to Assam.
Yeah. That's great, man. डॉक्टर गीता, आप 1992 से गुड़गांव में हैं और आपने अलग अलग हॉस्पिटल्स में अपनी सर्विसेज दी हैं, और उसके बाद अब आप आर्टेमिस में हैं। सो मैं अगर बोलूं, गायनेकोलॉजिस्ट में अलग अलग तरीके के केसेस आते हैं, अलग अलग तरह की प्रॉब्लम्स आती हैं जो आप लोगों के पास पेशेंट्स अपनी लेके आते हैं। सो किस तरह से की जो प्रॉब्लम्स हैं ज्यादातर आप लोगों के पास आते हैं पेशेंट्स लेके?
देखिए, आर्टेमिस हॉस्पिटल में मैं 2007 से आई एम देयर फॉर सो मेनी इयर्स नाउ, ऑलमोस्ट 12 years. It's a big tertiary care hospital. So what we get is the real high risk patients, because people from all surrounding villages, surrounding states, they refer the critical patients to us. So we deal with really high risk obstetrics. Obstetric means related to deliveries, and gynecology. Gynecology means any disease related to women. So we deal with really high risk cases at times, and normal cases also come, but mostly as a tertiary care hospital we have to deal with very high risk cases. So sometimes patient come on ventilator, we have to save both baby and mother. Situations, I have faced that kind of situation also. We operate on patients who have come on ventilator, hemoglobin 3 gram. You have to save the baby as well as mother. Dengue patients, pregnancy with dengue can be very dangerous, because in delivery normally you bleed, normally. And in dengue, when your platelet is low, your bleeding will not stop. Now in that case, when patient is in labor, you can't stop natural labor, so you have to deliver. So in that case, you have to save both mother and child is a big challenge to us. And in fact, I remember I dealt with a dengue patient, and which was there in Times of India all over, because that patient had platelet less than 20,000, and which normally is 1.5 lakhs and above. Patient was in labor. Now 3 hospitals refused the patient. We have no facility. Now 4th was our hospital. I saw the patient. I knew the situation, but I my heart said, you have to try, because you have to save the baby or mother. If we send them, in half an hour, anything can happen. So we took the case, and luckily, both baby and mother survived. So that was such big satisfaction. We could do it because Artemis gives us all the backup. Because we have a huge blood bank which can give us any kind of blood. ICU, very well equipped ICU, anesthesia team is very good. So we have a good team of doctors, and we can deal with all the high risk cases. So many other high risk cases we deal with. Yes.
So मैम, जैसे आपने बताया कि ये एक बहुत चैलेंजिंग केस था, where mother is suffering from डेंगू और उसका डिलीवरी था, एंड दोनों ठीक रहे. So
God's grace, इसमें भगवान का भी होता है. हाँ, हम तो इंस्ट्रूमेंट होते हैं मेनली.
गॉड. मैम आपने बात बोली. अच्छा, एक चीज बताएं मैम, जो पूरी टीम होती है, जैसे आपने बोला आपके ब्लड बैंक है, हॉस्पिटल में सारी टीम और जो आपका सपोर्ट स्टाफ होता है, पूरा टीम मिलकर इस केसेस को हैंडल करता है. सो इज इट लाइक दैट, जब भी कोई इस तरह के चैलेंजिंग केस आते हैं तो पूरी टीम बैठ के डिस्कस करती है?
See, ऐसे होता है, like suppose there is an emergency, we have to take the patient to OT immediately. Main treating surgeon, suppose I am the main treating surgeon, and with me my associate team is there. Now we have to inform the concerned department as and when required. You rush, okay? So it's not that everybody can come and sit with you, but they are available.
Okay, so they are available.
They are available. Okay. Suppose another department has a problem, we are available. Okay. It's like that.
It's basically like teamwork.
Teamwork, okay. And as and when required, everyone is available.
सी मैम, एक तो हमने बात की है डिलीवरी की, जब एक जो केसेस होते हैं उनके लिए, बट गायनी में अगर मैं बात करूं, एक और बहुत स्टेज आता है जब फीमेल्स को एक बहुत अलग तरीके के उससे टाइम से गुजरना पड़ता है, दैट इज मेनोपॉज.
यस.
सो आपसे मैं चाहता हूं कि थोड़ा सा उसके बारे में भी बताएं, ताकि हमारे लिसनर्स को कुछ उससे फायदा हो सकेगी.
यस. से आपने बहुत अच्छा टॉपिक बोला, मेनोपॉज, बिकॉज इन इंडिया मेनोपॉज इज अ वेरी लेस टॉक्ड अबाउट सब्जेक्ट. People talk about everything, cancer, everything, but menopause, people don't even bother what the lady is going through at that phase of life. It's a very difficult phase of life for a lady. A lady looks after the family till the time she is young, and then during menopause, so much of hormonal changes you go through, the lady goes through, but that time you have a lot of changes, physiological changes in the body, natural changes. So at that moment, you need a lot of medical support as well as guidance, good guidance, and family support. So abroad there are menopause clinics, but in India hardly any menopause clinics are there. So in fact I've written a booklet on menopause, and where I have tried to mention in a very simple language so that common people can benefit from the booklet. And yes, it is a time of life where everyone should see a doctor. Everyone, okay. All ladies should see a doctor. They should go through particular checkups. If there is any deficiency, they should take care of it. And there are certain tests like pap smear and all, they should go through regularly. And doctor can help the lady. We can counsel how to go about in that transitional phase. The lady can go through a lot of mood swings, irritability, dryness of skin. These are small problems, but it can irritate you. Because of hormones, you are going through mood swings. But family will think you are big changing. They get irritated, So family need to understand. So along with the lady, I think the husband, children need to be counseled. That she needs support now. All the time she was supporting you. Now the lady of the house needs support. And actually, we can help her.
डॉक्टर बरुआ, आप क्योंकि अब आई हैं तो मैं आपसे एक चीज चाहूंगा कि हमारी सुनने वाली महिलाएं जो हैं, वो फीमेल्स जो हमारे लिसनर्स हैं या मेल भी जो लिसनर्स हैं, उसमें अलग अलग एज ग्रुप के लोग होते हैं, तो आप उनके लिए प्लीज कोई एडवाइस, कुछ चीज बताना चाहेंगी?
Sure. Actually, for young girls, basically, I want to say do some physical activity, because these days, because of irregular lifestyle, a sedentary lifestyle of young kids, video games and all, they develop a condition called Polycystic Ovary, which can lead to menstrual irregularity, weight gain, and later on, they can face problems in childbirth and all. So conceiving and all. So we need to address it from the beginning. Do some physical exercise, and if you are facing some problem, then see your doctor. Don't wait at home. One is that. Second, for young girls, these days cervical cancer vaccination is available. So all parents, all the mothers need to know that the young kids, before they have the exposure to sexual life, we need to give the vaccination, because the cervical cancer is one of the main cause of women's death in India, and it is preventable. So we need to know that this can be addressed from the young age, and the virus comes from, it is sexually transmitted. So we need to prevent it by giving the vaccination at a young age. Like, according to American Journal, it is 11 to 13 years of age. But in India, we can give before the child is girl is exposed to sexual life. So maybe 16, 17, 18 years also. And for the young women, I would say stop smoking, because smoking causes infertility and lead to many other diseases. And sometimes it is very difficult. It is one of the causes of breast cancer. So stop smoking. These days many girls are smoking. Please, it is not really cool to smoke, And another thing is, for all the young girls, you have to practice safe sex. You have to know what is to be done and what is not to be done to prevent against cervical cancer. And for the elderly generation, take help during your menopausal age group, and also to prevent cervical cancer, go for a very inexpensive test called pap smear, which is once a year. If you do, you can come to know in a precancerous stage, and so many ladies' life can be saved.
थैंक यू डॉक्टर, थैंक्स अ लॉट. बहुत ही आपने अच्छे तरीके से बताया, एंड आई थिंक जो हमारे सुनने वाले लोग हैं जो इसको देखेंगे उनको ये बहुत ही इंटरेस्टिंग लगेगा. डॉक्टर गीता बरुआ ने बहुत ही अच्छे तरीके से चीजों को रखा और बताया. डॉक्टर बरुआ, एक बार फिर आपका बहुत बहुत धन्यवाद स्टूडियो में आने के लिए.
थैंक यू सो मच.
सो लिसनर्स, अब आपसे विदा लेते हैं और उम्मीद करते हैं कार्यक्रम आपको अच्छा लगेगा. सुनते रहें रेडियो द्वारका, एक कदम कल की ओर.